Okay, so let's get into this. Welcome, everyone. We're exploring some really relatable insights you shared from working in health IT. Specifically, this feeling of being deep in the work, you're reading the specs, you're in the meetings, maybe even leading parts of projects, but still feeling a bit disconnected, like you don't quite see how your piece fits into the whole patient care picture. You mentioned doing complex technical work, integration stuff, but the overall system, still a bit fuzzy. If that sounds familiar, if you've ever felt like you had a piece of the puzzle but no box lid, well, this is for you.
Yeah, that feeling. It's really common. And based on what you shared, you articulated it so well. You talked about having the experience, right? Doing the documentation, being in those meetings, leading work streams even. But underneath, there was this nagging feeling like maybe you were kind of faking it when discussions turned to how data actually moves between systems, say from the hospital EHR to a specialist. It wasn't that you didn't understand your tasks. It was a lack of clarity on the whole journey, that quiet question. How does this really connect?
Exactly. It's like you see the dots, maybe an ADT message here, a lab order there, but you're missing the lines connecting them. Missing the why. Why this step? What triggered it? And crucially, what happens next? Like after the patient actually leaves the hospital, it's like you needed the map, not just the locations.
Right. And you found that just digging into more technical documents or, more theory wasn't the answer, wasn't filling that gap. What you realized you needed was something, well, real, a story, something grounded in context.
And that's where this idea of following a patient journey came in for you, the breakthrough.
Precisely. You mentioned tracing a patient, let's call her Maria, right from the beginning, maybe an ER check-in or an admission, and following her path step by step. Seeing the lab order get placed in the EMR, then seeing the imaging report come back electronically, understanding the flow all the way through to discharge planning, maybe even follow-up appointments, that's what made the system, come alive.
Okay, so seeing it in motion, that's when it clicked.
Yeah. You said, for the first time, you really saw why moving that piece of data mattered. Not just that it moved, but why. You understood who needed it down the line and how their decisions depended on getting it. Suddenly, every step, every message, like that ADT message signaling an admission or an ORUR01 message with results, you saw it trigger something important. It wasn't just technical jargon anymore. It was part of a meaningful sequence. Seeing that was, well, transformational is how you put it.
And through that lens, all those concepts that maybe felt a bit abstract before, things like patient consent or identity management across different systems, or even the technical standards like HL7 version 2 messages or the newer FHIR standard, they started to make practical sense. You saw how they actually function within typical EHR systems, or how maybe a health information exchange and HIE plays a role in connecting different providers. It just changed how you saw everything.
Exactly. And another interesting thing you mentioned was using a tool alongside this, like a personalized AI agent. You described it as sort of a safe space. You could ask the basic questions maybe you felt awkward asking colleagues in a meeting, just exploring concepts in plain English without feeling judged until things really settled in and made sense for you.
Right. So the overall transformation you described was huge. Going from feeling, I guess, stuck or just following orders to really understanding the system and feeling like you could contribute on a bigger level, whether that's improving patient care, making the system work better, or just seeing the real impact. You talked about a newfound confidence, being able to explain things, troubleshoot better, guide others, even spot problems before they happen. Because you finally grasped the why, not just the what. It sounds like you felt you truly belonged and could offer real insight. So it really seems the key takeaway from your experience is about perspective. Sometimes you have to shift from looking at technical diagrams to seeing the entire system through the eyes of a patient moving through it, connecting the tech to the person, to the actual flow of care. That seems to be the context that was missing for you.
Absolutely. And if you're listening and you've ever felt that way, you know you're smart, you're capable, you're doing good work in health IT, but you still have that quiet uncertainty about how it really all connects in practice, that why. You're definitely not alone in that. Maybe seeing the system through this different lens, the patient flow lens, is the kind of clarity you deserve. You probably don't need another list of acronyms or technical specs. You need the picture. If anything we've discussed resonates, maybe it's your time to see the system differently too. This approach, following Maria's journey, might be where that starts for you.